All around our state, when it comes to our nation's healthcare system, there's no shortage of opinions.
Healthcare system right now needs some help.
I just don't understand how we can be such a wealthy country and disregard so many people.
It is overpriced for most of the people in America.
No one should fall through the cracks in the healthcare system in the U.S.
The American healthcare system ranks #1 in the world for cost, but according to the World Health Organization, for quality and fairness, we rank 37th. And in the last several years, insurance premiums have doubled, far outpacing inflation and personal incomes. According to Katz, a health policy expert at the University of Washington, healthcare costs are rising so much, medical insurance is no match for medical expenses.
Many people who are bankrupt because of medical costs have insurance.
In fact, right now, medical bills are one of the major causes of bankruptcy. All it takes is one serious illness, something Jeannie Barber, who lives in Spokane, knows all too well. For her, it was breast cancer, the loss of her job, and her insurance that added up to the perfect storm.
Within an 8-month period, I had a mastectomy, gallbladder surgery, chemotherapy, and a hysterectomy.
Jeannie had just started a new job when she needed her first 2 surgeries. Because she lost so much time from work, she was fired. At the time, Jeannie believed the continued health coverage, or COBRA, she had from a previous job would cover her medical bills.
So it was like they dropped a big, huge atom bomb on me. I was devastated. I didn't know what I was going to do, and I had no way of knowing how I was going to pay for chemotherapy or anything, or any of the other treatments that I would have to make sure that I wasn't going to get cancer again.
Fortunately, Jeannie didn't fall completely through our fragile safety net. She qualified for financial aid from a Spokane agency that helps low-income people facing a medical crisis. Jeannie was able to finish her treatment, is employed again, and so far, cancer-free. But the mental scars from the whole experience haven't healed.
You feel terrible. You feel like nobody cares about what's happening to you or your family. I was on hold, our whole family, it was like we were circling for a landing this whole time, and nobody wanted to clear a runway for us.
Healthcare workers see the results of our crisis firsthand.
Every day I see people come through the door without healthcare insurance, and it's time that we had healthcare insurance for all.
My hope is that anyone, people who are self-insured, people who have their own businesses, that they'll be able to have health care and be able to still hold their businesses, still be able to work. If they're not working, be able to go see the doctor when they need to see the doctor.
It's a difficult situation because, and it's just not fair, because the old-timer, I'd like to be paying him $10 more an hour, but I'm paying so much for his insurance.
Tom Weber has been in the road construction business for more than 30 years. He's always provided benefits for his employees. In earlier times, it was easy. Now it's a struggle.
The health care insurance didn't used to be a big deal for us in relation to our gross sales and our income, and so it was an easy thing. We used to have dental, we don't anymore. When you're paying a premium of $500 a month for one guy, or up to $1,100–1,200 for a guy and his spouse, becomes a big deal.
But for Tom Weber, even though offering benefits is expensive, he believes it's the right thing to do.
I have been around a long time. I've seen people's children born and graduate, and I've got some guys, I've had people retire, and I've seen their families raised, and without insurance, they'd have been in trouble.
Across our nation and across our state, there may be disagreement on how to fix our healthcare system. But one thing most of us agree on: we need safe, affordable, and accessible healthcare that's available for everyone.
It's an inherent part of, I think, being a human being, and I believe strongly it's a core of what it means to be an American. You can't pursue life, liberty, and happiness if you're sick and can't get treatment.